Hello everyone. So today I will discuss about diabetes mellitus type 2 in these diabetes disease series. So let's start. So as we have seen, diabetes is a chronic disease where the body do not produce enough insulin, that is the type 1 diabetes, or the insulin produced cannot be utilized in the body by the body, that is type 2 diabetes mellitus. In type 2 diabetes mellitus, what happens is the cells cannot use insulin, that is they become insulin resistant, and therefore the glucose level in the blood increases. So as we have completed diabetes insipidus and diabetes type 1, we are here to deal with diabetes type 2 today. I hope by now we know the risk factors, symptoms, preventions, and complication of diabetes. Diabetes mellitus is basically a chronic disorder characterized by high blood glucose level. It is due to the impaired insulin secretion, that is in the case of diabetes mellitus type 1, or resistance to the insulin, that is type 2 diabetes. According to the International Diabetes Federation, approximately about 415 million adults between the age of 20 to 79 have diabetes mellitus in 2015, and there is a global concern that the number will rise to another 200 million by 2040. So therefore, we will have around 615 million cases of diabetes mellitus, that is, including type 1 diabetes along with type 2 diabetes. Type 2 diabetes is a long-term disease, which means you have to manage it for the rest of your life, and there is no cure for type 2 diabetes. There is a term that is called pre-diabetes, which means the blood glucose level is higher than the normal, but it is not enough to be diagnosed as diabetes. And therefore, the person is at higher risk of getting diabetes and thus has to control the blood sugar level. Etiology: type 2 diabetes accounts for around 90% of diabetes. Type 2 diabetes, the response of insulin is lost, as I have previously said, and this loss of insulin response is called insulin resistance. During this stage, insulin is ineffective. That is, the cells cannot use the insulin, the receptors on the cell cannot get hold of insulin, and therefore the insulin production will increase to maintain the glucose homeostasis, but over time insulin production decreases, resulting in type 2 diabetes mellitus, as the cells cannot use the insulin produced. Type 2 diabetes is seen in person older than 45 years of age typically, but it is an increasing disorder in children, adolescents, and younger adults due to rising level of obesity, physical inactivity, and energy-dense diet. So the causes and symptoms of type 2 diabetes. So the cause basically include overweighing, obesity, not being physically active, the major point, that is insulin resistance, and genetics. Symptoms include feeling tired, higher urination, higher thirstness, less weight or gain of weight, blurred vision, wounds heal taking longer time, itching around your mm, sensitive areas, and getting thrush. Who is more likely to get type 2 diabetes? A person is at higher risk if he or she is white and over 40 years of age, or 25 years old, and from a South Asia, Chinese, Black African, Black Caribbean ethnic background because of the genetics. A parent or a brother, sister of the person who has diabetes, overweight, and not physically active, a condition that increase your risk, such as high blood pressure. Although type 2 diabetes is less common in children, ethnic background, weight activity, and family history can also increase the risk. How do healthcare personnel diagnose type 2 diabetes? The following blood tests are used. That is fasting plasma glucose test. This is done in the morning when with empty stomach after an 8 hour of fast. That is the period between your dinner and your breakfast. A result of about 126 milligram per deciliter or higher means you have diabetes. Another test is random plasma glucose test. This lab test checks blood glucose level but is done without fasting. A result of about 200 mg per liter or higher means you have diabetes. A1C test measures the blood glucose level over the past 2 to 3 months. A result of 6.5% or higher means diabetes. The most important thing that distinguishes type 1 diabetes from type 2 diabetes is autoantibodies. What happens is in type 1 diabetes, the pancreas, that is the beta cells of pancreas, are destroyed by autoantibodies, and thus insulin is not produced in type 1 diabetes. So the presence of autoantibodies will give the proof that the person has type 1 diabetes. How is type 2 diabetes mellitus treated? So like other disease, patient has to manage type 2 diabetes by its own with respect to the healthcare guidance. This includes primary care with respect to the physician and dietitian, certified diabetes care and education, ophthalmologist, that is eye doctor, because your retina is affected by diabetes along with your kidneys too. So there should be nephrologist involved in the treatment of diabetes. Managing type 2 diabetes is challenging and you have to make tough decision with respect to your diet and you have to adhere to it. The core feature of type 2 diabetes management include lifestyle changes, exercise, eating adjustment, blood sugar monitoring, and medications. So, and coming to the exercise of type 2 diabetes, what is the effect of exercise if you have type 2 diabetes? So regular activity is important for everyone. However, it is most important for the patients who have diabetes. So exercise can lower the blood sugar level without medications. In short term and long term, it burns calorie and therefore helps you to weight loss. If you are gaining the weight uncontrollably, improves blood flow and blood pressure, increase your energy level and boost your moods, help with stress management. The general goal is to get at least 150 minutes per week to moderate intense physical activity. So type 2 diabetes diet. The key to eating with type 2 diabetes is to eat a variety of nutritious food. In general, lean proteins like chicken, egg, fish, and turkey. Lean protein is food that are high in protein and low in fats, particularly saturated fats. Non-starchy vegetables like broccoli, green beans, salad greens, and cucumbers, because starch is again a source of glucose, which will increase your blood level ultimately. Healthy fats like avocado nut, natural peas, butter, olive oil, which has a source of unsaturated fats, complex carbs like beans, berries, sweet potatoes, and whole wheat bread. Type 2 diabetes medications. So, coming to the medicines, oral diabetes medications are um, given or prescribed by the doctor. The most common is metformin. The doctor may prescribe one or more of the medications at a time to achieve the best result. GLP-1, which is glucagon-like peptide 1. It is a natural hormone that helps to regulate blood glucose level, food intake by increasing insulin production. GLP-1 GIP antagonist, gastric inhibitory polypeptide, is the full form of GIP, is best known as incretin hormone, which stimulates insulin release to regulate blood glucose and nutrient homeostasis. And insulin, that is synthetic insulin, directly lowers the blood sugar level. As discussed in previous sessions of diabetes, other medications to manage coexisting conditions like high blood pressure and high cholesterol is also required. So now the question comes, can we prevent type 1 diabetes? Certain strategies are there which can lower the risk of type 2 diabetes. Exercise regularly with the target of 150 minutes a week. Eat healthy, no smoking. Unfortunately, some people may have a strong genetic risk factor that give the higher chance of type 2 diabetes. So the diagram illustrates the overall um, vision of type 2 diabetes. So your pancreas normally secrete insulin, but the muscles are not able to take the insulin because they are insulin resistance. The receptors are non-functional, and therefore the food you take has glucose, and the glucose is not broken down by insulin because your cells are not taking in insulin, and therefore your blood glucose level will rise. So thank you, like, subscribe and share.